what do they do? Are they important to the body?
The kidneys are two fist-sized organs that are in each individual in the back part of the abdomen or the tummy in each of us. We're born with two kidneys. And despite their relatively small size relative to the rest of the body, they're so important that they actually take a quarter of the blood that comes from the heart. Wow. And that is a reflection of how important they are. The function of the kidneys are to excrete the wastes of metabolism. So once your food has been processed and digested and absorbed, it goes to the cells utilize what it wants, and whatever is the waste is now excreted by the kidneys, mainly as nitrogenous wastes. And so if you have kidneys that are not functioning, you find that such wastes would accumulate in such individuals. Secondly, the kidneys actually regulate the amount of water that you have in the body. So if you drink a lot of water, you'll pass a lot of urine. If you don't drink so much water, the kidney conserves water as best as it can, and so you won't pass as much urine. The kidneys also regulate your electrolytes, so things like your sodium, which is what is contained in salt, your potassium, your chloride, your calcium, your phosphate, all those things are regulated by the kidneys. So if there's a lot of it, the kidney ensures that more of it goes out. If there's not enough, it tries to conserve. It also regulates your acid-base balance. So if you have too much of acid in the body, the kidneys will excrete it. Surprisingly, the kidney is also what regulates your blood pressure. That's right. So when the kidneys fail, one of the key things that happens in individuals is that you then develop a very high blood pressure. And in fact, when individuals have chronic kidney disease, those are instances where you need to use multiple medications to control the blood pressure. And despite the fact that the bone marrow actually is what produces blood, the stimulus for the bone marrow to produce blood actually comes from the kidney. So the kidneys produce a hormone which we call erythropoietin. And it's that erythropoietin that stimulates the bone marrow to produce blood. So when the kidneys fail, one significant component of kidney failure is actually anemia. And severe anemia that persists unless you're in a position to replace that deficient hormone.
So when these kidneys fail, what happens? First, let's talk about what causes kidney disease and then what happens when it happens.
Now, several things can lead on to kidney failure. And usually we divide disease of the kidney into the acute and the chronic. The acute, by definition, are those that occur suddenly and are what we say potentially reversible. If you're able to identify what led on to it and you're able to eliminate it, those individuals would recover completely, supposedly, from such kidney failure. But you find that that is not quite as common as the chronic kidney failure. And chronic kidney failure is, in our own environment, is due to many things that are very common in our environment. So hypertension is one of the more common causes of chronic kidney disease, and it's not surprising that it's common in our environment because 1 out of every 4 adult Nigerians has a blood pressure that is higher than normal or hypertension. Secondly, diabetes. That is something also that is on the increase. 20 years ago, the prevalence of diabetes in our environment was just 2%. It's estimated now that in Lagos, 8.8% of adults are diabetic. And kidney failure is one of the not infrequent complications of long-term diabetes, particularly when this is not well controlled. Yes. Thirdly, what we call chronic glomerulonephritis. Yes. This essentially is an immunologic damage to the kidneys that follows on any chronic infection. So it can follow malaria that has lingered and has not been well treated. It can follow hepatitis B. It can follow hepatitis C. Hepatitis B, 1 out of every 7 Nigerians, 15% have hepatitis B. About 8% have hepatitis C. So all these are common illnesses in our environment that tend to be chronic. And it's the individual's reaction to the presence of these infections, these chronic infections, that leads on to antibodies being produced, antigen-antibody complexes that eventually lead on to the chronic glomerulonephritis. There are a few others that I usually would like to mention, not because of how frequent they occur, but because they're so preventable. And they include the use of bleaching and skin lightening creams. Many of these contain mercury. I know in the days of Professor Olikoye Ransom-Kuti as health minister, he actually ensured that these were banned.
Yes.
But gradually they've crept back into the market and everybody's using them. Many of these contain mercury, and the mercury, enough of it is absorbed through the skin and eventually ends up in the kidneys, where it actually can cause kidney failure. And then the use of analgesics. There's actually an illness known as analgesic nephropathy. And up till 20 years ago was probably the commonest cause of kidney failure in Australia. So it's not uncommon, and it's not just in our environment. So the individual who at the end of the day feels he's tired, goes to the local chemist, and they give him ashakbo, where they give him paracetamol, Panadol, and all manner of multiple analgesics. And you do so consistently, your kidneys will fail. But I think some other thing which we should stress is the fact that we do recognize that for some reason, kidney failure appears to be a disease of the black man.
Yes.
Several studies have been done in various communities where you have varying population or racial population. And they found that in America, you are more likely to have kidney failure if you have hypertension or diabetes, if you're a black person than if you're a white person. And so you're 4 times more likely to develop kidney failure if you're a black man. So there's some genes that have been identified which have been found to be more common in people of African origin. Yes. And it is the presence of these genes that we suspect is what predisposes people of African origin from having or for having kidney failure. And there's what we call the apolipoprotein 1 gene and the MYH9 gene. And it's been found that if you inherit these genes, the chance that you'll get kidney failure is heightened.
So Dr. Bamgboye, can you tell us what the signs and symptoms of kidney disease are?
Well, the earliest signs that you'll get, surprisingly, would be you're making too much urine. We do recognize that for those, particularly with a chronic kind of kidney failure, some of the earliest signs you'll get was what we call nocturia. An individual who's waking up several times in the middle of the night to pass urine. And then gradually as the disease progresses, the individual then becomes oliguric. His ability to make urine, in the volumes that is ideal, diminishes. And on account of that, the individual now notices that he starts getting pedal edema or pedal swelling.
To their feet and legs.
By the time, at the end of the day, he finds when he looks at his feet, they're slightly more swollen than they should be. Yes. And when he presses down on it, it indents and leaves a depression, which is a sign that there's fluid within the interstitial space of the tissues of the feet. And then he sleeps. Yes, sometimes the feet become normal, and then his face becomes puffy. So puffy face, pedal swelling, are some also of the earlier signs that you get when you have kidney failure. And then the individual now becomes anemic. As we said earlier, the kidneys produce erythropoietin that should stimulate the bone marrow to produce blood. They don't do it as efficiently when an individual has kidney failure. So the individual becomes anemic. And then the blood pressure becomes super high, becomes very severely elevated. And usually those are the ones that you need 3, sometimes 4, sometimes even 5 antihypertensives, just to be certain that you can control the blood pressure. There's no part of the body that is spared
from kidney disease
when a person has kidney failure, right from the hair, which now becomes very curly. It's almost as if the person has done Jerry curls, and then becomes very fluffy and sometimes might change in color, to even the nails of your toes and your fingers. They also change in consistency. The skin becomes very sallow as well. And then, the individual loses appetite, is not able to eat, has a lot of nausea as the urea and creatinine, the wastes build up in the body. The individual starts to vomit, develops abdominal pain. And when he now starts to retain fluid, and electrolytes in the body, you find that some of those fluids are retained within the lungs, and the individual goes into what we call pulmonary edema, and then he finds it difficult to breathe.
Yes.
Develops a cough, becomes weak, finds he can't go distances without getting...
So talk to us about the treatment of kidney failure.
Usually with treatment, you have several options. But probably the best treatment, which we'll discuss later, will be prevention. But once you've developed kidney failure, you need to recognize what was the etiology of that kidney failure.
What caused it in the first place.
And that needs to be controlled. So if the individual has hypertension, you want to control the hypertension. If he's diabetic, you want to ensure that the diabetes is well controlled. If he's been taking some offending agent, you need to ensure that that offending agent is stopped. And once you've done all these things, which you call conservative management, and the individual is then still symptomatic, then you have to go ahead and do a few other more interventional kind of therapies. And they include dialysis and a transplant, particularly when you're dealing with individuals who have chronic kidney disease. Dialysis is an artificial means of carrying out the function of the kidneys. So it doesn't repair the kidney, but it does what the kidneys should do and ensures that the person doesn't succumb to the absence of the kidneys functioning normally. So you find that it would regulate the amount of water in the individual. You can take out excess water using dialysis. It would remove the wastes or the metabolites, the nitrogenous waste that the kidney is not able to remove. You can, in the process, correct the anemia, and you can correct the acid-base imbalance. Yes. But we clearly know that kidney transplantation is probably the best modality for managing individuals who have end-stage kidney failure. It's, on the long term, is cheaper. The risk of mortality is about half. And the quality of life of an individual who's had a transplant is much, much better than anybody who remains on any of the various modalities of dialysis.
So what is it that the individual must do to prevent kidney disease?
Yeah. I think that is probably the most important part of our conversation today.
Yes.
The fact that we must recognize that prevention is key.
Yes. Yes.
And prevention means recognizing the common things in our environment that can cause your kidneys to fail. For chronic kidney disease, we've said hypertension.
Yes.
So one must recognize that if you have hypertension, you must recognize that it's a disease for life. It's not like malaria. You take treatment for a while, you feel better, and then you stop until you get it again. Once you start your antihypertensives, you must continue them for life. And you must ensure that you visit your doctor regularly and ensure that your blood pressure consistently is well controlled. Below 140/90, or if you do have protein in the urine, below 130/80 consistently. If you have diabetes, it's important that you check your kidneys regularly each time you go to see your doctor. And it's not just important to check and see if you do have protein in the urine. By the time you have protein in the urine,
you're already in trouble.
You're already in trouble. So there are tests that you can do which will detect the earlier stages of protein in the urine, which you call microalbuminuria. And you should, if you're diabetic and you go in to see your doctor, ask him to kindly do that test for you. Because fortunately, that is the only stage of protein in the urine that is reversible.
Okay.
Once you've developed overt proteinuria, the horse has already bolted
Yes.
out of the barn, and there's nothing you can do. You can only slow down progression. You can't reverse it.